I'm really excited to have you on for so many reasons. And I discovered your book this spring. And I think that you and I have so much in common in wanting to bring education and information that has not been understood and bringing people up to date. And I'm going to introduce you and have some questions, but I'm probably have more questions than we could ever cover in a short visit. And I have both of these books here read twice, lots of great information. And I refer a lot of my patients to read this in their families. This is Donna Henderson. She is a clinical psychologist specializing in neuropsychological evaluations for children, adolescents, and adults who would like to understand themselves better. She is a sought-after lecturer and provides training and consultation for other healthcare professionals. And she's the main author of these two books, Is This Autism? A guide for clinicians and everyone else, and then a companion guide for diagnosing for those who are clinicians and physicians on the diagnostic side. And actually, I think it's great for patients and their families who just want to learn more and understand brains better. But welcome to the podcast.
Thank you so much for having me. I really appreciate it. Like you said, I think we have a lot in common, so I'm excited to talk to you. And I just want to add, I have two fabulous co-authors for the books, Doctors Sarah Wayland and Jamel White.
Yes, I didn't want to leave them out, of course. It's a collaborative, and like myself, you are standing on shoulders of many years of research and expertise to help grow an understanding. And co-authors, it's hard to do all this on your own, and you did an incredible job of over 100 authors or contributors insight for the book, which is great, very comprehensive. I would love to hear your journey to get to where you are now in this understanding, because as you share in the book, this wasn't something you came out of training. You're in the similar generation as myself when I was taught in med school in the early 90s and then residency in the late 90s that this was rare and you should send it to only subspecialists who can diagnose this. And it wasn't common, and it was very much a stereotype. And so how did you get to where you are now?
Yeah, actually, again, very similar to your story. I went to graduate school a really long time ago, and there was, I think the word autism may have come up a handful of times throughout all of my training. It just wasn't really part of the training at all. And when it was with that, go send them to a specialist kind of thing. And then for the first part of my career, I never thought about autism or whether or not my clients might be autistic. And that was normalized by everyone I work with, my colleagues, my supervisors. That was the way it was for 99% of them, I think, that I interacted with. And then I got to a point where I realized that made no sense at all. And it was this moment I was with a very particular client. I won't tell the whole story now, but I wasn't even thinking about autism. I was just trying to figure out this one client who had been evaluated a million times by a million people and had a gazillion diagnoses, right? ADHD, anxiety, depression, this, that. And it just hit me like a flash. Like I saw her as a whole person instead of all the little parts. As soon as I saw her as a whole person, and what flashed through my mind was she's autistic, and all of a sudden everything makes sense. Like she came into focus for me. And that started me on this long journey of trying to research this and understand it for myself. And for a big part of that journey, I thought it was just me that didn't get good training in this. And I was secretly embarrassed by it. And then I gradually started to realize, oh no, this is not just me. This is our whole field, all of healthcare. And so I started talking to other people about it more and more, and eventually wrote the books.
Yeah, and that's so appreciative. It came out a year ago. I'm sure that's years of coming with an idea years ago. So maybe start this, and then I'm guessing you looked on the bookshelf and said, "There's probably a book I can just refer to," and there wasn't that type of book that you were hoping to bring up to date, similar to the book I did with Conquering Your Fibromyalgia to Do My Best, and even that has changed in just 4 years as we're learning more. One of the questions that many of my adult patients, as I take care of newborns all the way through adults at retirement age and everybody in between, and I've worked and recognized autism in all age groups from my oldest patient being about 77, who, when I saw him, he had said, "Can you help me? Do you know anything about hoarding?" And on his medical problem list, as he was new to me, it said dysthymia, depression, anxiety, social anxiety, all of these different things. And just meeting him and figuring at age 77, he hasn't got bombarded with a bunch of TikTok videos on that he could have autism or YouTube. And I just broached the topic with him and doing some probing questions and some of those stereotypes and that or traits that you may see. And I said, there's this thing called autism. I don't know if you ever heard of it. And he's, yeah, my grandson got diagnosed. I'm like, okay. So it's all ages too. Then when you start to look for it, even what's nice is if you have that family history and your awareness, then you can start to recognize even in infancy, if you have siblings and family to be aware of. And I think earlier you would know, I think most people wish they would have had this insight that they have now, but we didn't know. We didn't have that insight. What would you say to someone, especially the adult, who, with the question, does it make a difference? Who cares if there's a diagnosis? I'm just sharing that. I do think it makes a difference, but what would you say for all of those who might be listening out there?
First of all, of course, it's very individual. I think there are some people out there who don't feel a need to label their neurotype, and that's fine. If they don't feel a need and they're not struggling in any way, then I don't think it would make a difference for them. But for people who have struggled, which is so many autistic people, they maybe have struggled socially or with their careers or with anxiety or depression, or certainly in relationships, with flexibility. If they're struggling and they really just want to understand themselves and figure out how to be in the world in a way that feels both functional but authentic to them, then having language to understand themselves and to explain themselves to other people, whether it's people they're in relationships with or their healthcare professionals or their educators, to be able to put words on it, that's a foundation for self-advocacy, right? For getting your needs met. And I think it's so essential just on that very functional level. And separate from that, I think it just changes how you talk to yourself and how you think about yourself, your internal narrative, right? And I can relate. I'm not autistic myself, but I can relate because I got a diagnosis a few years ago of EDS, which was really similar in a way that I was going from doctor to doctor from a very young age, having so many different orthopedic injuries and orthopedic surgeries. And I have pain here and I have pain there. And honestly, I always thought I must be clumsy and I must be a wimp because I have so many orthopedic problems and injuries and pain. And it was always a self-blamey kind of thing. And I tried to never talk about it because I figured it was just me. And when somebody finally said, no, actually, you have Ehlers-Danlos syndrome, like this is real and you're not a wimp. You're actually pretty strong that you've managed all of this. It changed how I see myself completely. It fundamentally changed. It let me be much more compassionate to myself, to give myself a lot more grace. What could possibly be better than that, right?
Yeah. And that reminds me of so many stories when I get a chance to, I'm not autistic and I enjoy using the word autism. I just think these are, like I say, different ways of experiencing, interacting, and responding to the world, like you say in the book, but it can cause a lot of distress. But having a chance to learn a different culture, if we go to any culture that's maybe not the US culture, even within the US, to live there and understand and hear the stories of others, it can create great empathy. And I know with my patients that I'm working with that come in, often they come in to me with a chronic pain syndrome. And often it's not a yes, no, these are all a lot of coexisting comorbid conditions. And often they've been to many providers, psychiatry, psychology, therapy, and they're coming in their late teens or 20s, and nobody like you connected the dots for them because they, like you, the book emphasizes the average to above average IQ who tends to mask more, who gets missed, and there's something different. And then when you can just listen, it's very interesting about trust. And by the time as people get through childhood and adulthood, that trust in their bodies and themselves and around them is more suspect. And then to have somebody who's listening and just understanding that, yes, I have other patients who have this, and let me ask you some questions. And how do you experience and understanding? And when you're in these situations, and talk about these things, once you know what to look for, you can start to see this. And I see, like you probably do, lots of families who, once one diagnosis is made, oh, that makes sense. So one of the questions that you bring up, or points that I think is very important for people to know, and I hope for you to elaborate. Traditionally, we've used externalizing signs and symptoms as diagnostic criteria, but we're realizing that is only a surface level and sometimes can be helpful. It's not bad, but it can miss many people because of internalizing of symptoms. Can you talk about that?
Yeah, absolutely. We diagnose based on either the DSM here in the States or the ICD, and just the way that they tend to be written for autism, the diagnostic criteria is based on observable behaviors. And I understand why they were written based on observable behaviors, because we're trying to make this sort of consistent from clinician to clinician, right? We don't want it to be the Wild West where everybody's diagnosing things differently. And because in the stereotypical presentation of autism, there always are these very observable behaviors. But we now know from highly masking autistics that there is a lot going on underneath the surface, even though there may or may not be these observable behaviors. And one example is just being in a basic conversation where you might run into your neighbor at the mailbox and you do a little, oh, hey, how are your kids doing? And did you go on vacation yet? And that kind of back and forth. There are so many autistic people who can easily pull off that kind of conversation. But what is not evident, what's going on underneath, is not just anxiety, but a lot of conscious effort, conscious planning, conscious decision making to get them through that conversation. So it might, in their head, it might look something like, ooh, am I making the right amount of eye contact? I think I am. I think it might be time to look away now. He just smiled. I should probably smile now. He's been talking for a few minutes. I think it's my turn. Is it my turn? Wait, is this the point that I should say something? I think I should be asking a question now. What's a good question? It's this very conscious, effortful process that takes a lot of executive functioning. And there can be a lot of exhaustion afterwards. So for me, if I run into a neighbor and we chat for 10 minutes, I'm not going to feel tired at all afterwards. But for some autistic people, that alone could make them need to go back in the house and sit quietly for an hour just to recover from that 10 minutes. Everybody's different, of course, but that would not be uncommon for autistic people. So, really getting at the subjective experience, not just what's another really easy example is eye contact, right? So clinicians are taught to evaluate somebody's eye contact, but most of the autistic people we're talking about today learn at a pretty early age how to make typical eye contact, but you have to ask them, what is that like for you? Because non-autistic people, we don't really have a strong emotional reaction to eye contact. I don't know. I don't really think about it. But for so many autistic people, if you ask them, what's that like for you? They'll tell you something negative generally. It's unpleasant, it's distracting, it's effortful, it's annoying. I can't concentrate on the conversation as well, but they'll give you something. I think these are just a few of the many examples of trying to understand what's going on below the surface for autistics who camouflage.
And that overlaps with a lot of people who are living with chronic pain syndromes. And there's this spoon theory. I don't know if you've heard of that before. It's often
Sure,
lupus. And
sure.
and I realize, like, people are describing it for one thing, but it actually is also applying to autism. How much energy do I have? And instead of describing separate things, they're the same. And I'm involved in some Facebook groups with fibromyalgia. And it's often the question, like, do you ever get, quote, cured from fibro? You don't get, quote, cured from autism because it's your neurotype, but we can try to
Mhm.
help have the right supports. And if there are coexisting health conditions, treat them, education, awareness. It's often that interesting thing. There may be times when there's a lot more stress and duress where those manifest as a pain or anxiety or other, when you hit a certain boiling point and it overlaps. So it's interesting when you talk about it. One of the things you talk that often is confused or confusing for those who don't understand this is social interest and social energy. Can you talk a little bit about that?
Yeah, and I'll say spoon theory is huge in the neurodiversity world. Yeah, it's very commonly used in the neurodiversity world too. I didn't realize it was used in the fibromyalgia world actually.
Yeah, it's
Thought that
actually
was
started
worse.
there. It started in the lupus world. It was a patient with
Really? I
chronic
didn't
pain
know that.
lupus. Yeah, I believe that's what I'm understanding. And it's that theory, or you can use like electric battery, and I got to, recharge. And all of these are very interesting because we're often talking with the same group of people, but they may carry a diagnosis as fibro, chronic pain. And anyways, these are often the same elephant, different aspects and different words to
Yep.
describe parts of it.
Yeah, I hear you. So, sorry, back to your question, social interest versus social energy. And another way of saying social interest is saying social motivation. I would say those are
That's what I meant.
interchangeable.
Motivation. I'm sorry. Yeah.
Yeah. No, I think social interest is, I like it actually. So, autistic people, like non autistic people, can have a lot of social interest. There are some autistic people who are very socially motivated and very much want to have a lot of friends and a lot of social interactions. Or autistic people can have very low social interest and low social motivation and basically be like, no, I'm good. I have one friend. I see her twice a year. My needs are met. Need to be left alone now. So, one of the myths around all of this is that if you have a lot of social interest, you can't possibly be autistic. That's actually autistic people who have a lot of social interest or social motivation, I think are at higher risk for feeling lonely and depressed if they can't get their own social needs met. Autistic people who have low social interest or low social motivation, I think are at particularly high risk of feeling anxious because, especially when they're younger, they get pushed by people in their lives to socialize more than they want to or more than is probably good for them. And they're forced into doing it. And that can be really stressful for them. So each comes with its own different challenges. But all of that is different from social energy. And I think just like each of us has differing levels of physical energy, some people have a lot of physical energy and some people don't. I think some people have a lot of social energy and some people don't. And one thing that I think is not uncommon with autistic people is to have more social interest than you have social energy. And I have an autistic psychologist friend. Her name is Megan Anna Neff, and she has a very well known and very loved and respected website, Neurodivergent Insights. And she once said to me, my soul longs for connection, but my body resists it. And that has really stuck with me. And I think that really gets at the social interest is my soul longing for connection, but the low social energy is my body doesn't hold up well to it. And then that can really create a lot of loneliness and sadness. And I think that can be really challenging.
Yeah. Actually interviewed her weeks ago.
Is that right?
Actually
Oh,
found her
definitely.
through her book. And I'm like, I sent you the request months ago and got a chance to connect with her. Actually got her book too. And in sharing that with others, I think yours and hers complement each other very well to help people understand. And actually these same things that are helping the autistic person also are the same type of things that often are self-care for people who have these chronic pain issues. And often it's not even knowing that there's this aspect because we may think of pain. One of the interesting things that social interest was somebody contacted me from the podcast and we talked a little about her daughter who was very socially engaged as a little girl, had some ADHD, got diagnosed, but still has these anxiety things going on in his middle school. Not her doctor, but talking a little bit our family history. I said, there may be some of the spectrum. A dad who was diagnosed as bipolar, but never reported any manic episodes. And then the same psychiatrist says, oh, I know your dad. I know you. I'll put you on a mood stabilizer. And not even aware. And then I said, that's interesting. And I'm going to hear your thoughts that early age social interaction for girls is relatively not complex. And then you get into middle school and beyond, the complexity is going to be there. So it may have appeared that she was social when she was younger and now is going into the shell. I don't know if you can comment on stories like that that you
Yep.
see.
It's so common, actually, particularly for autistic girls and those with average to above average intellectual functioning. So the atypical timeline, a very typical timeline, is nobody has any major concerns about her in elementary school. If there are some, they either get coded as ADHD or anxiety, which may be accurate. And then sometime around fifth grade, sometime around age 10, is when we see things really starting to shift and becoming a problem. And nobody thinks of autism because nobody was particularly concerned before around fifth grade, except that this really is the timeline. And there are good reasons for this. When you think about how first graders or second graders or third graders socialize, right? You're playing freeze tag, you're playing hide and seek, you're just running around out there physically playing. And so it's a lot easier for kids to connect in that way. It's based on proximity. Who lives on your street? Who is in your class at school? Who is on your soccer team or in your Girl Scout troop? Who is your mother's best friend's daughter? That kind of thing, proximity. But sometime around fifth grade, could be fourth grade, could be sixth grade, but generally fifth, maybe sixth grade, that really shifts. And now, especially in girl world, friendships are based more on common interests and reciprocal sharing of personal information. And that's one of the reasons why these girls can start to struggle when that shift happens. And at the very same time, the moms are removing themselves. They're no longer scaffolding. It's no longer moms calling each other saying, hey, let's get the girls together on Saturday. The girls are starting to take charge of that. And if this girl is having trouble with that, on top of having trouble with reciprocal interactions and sharing personal information and showing interest and all of that sort of thing, boy, is that bad timing. And then on top of everything else, that's around the time hormones are starting to hit, her body's starting to change, which is going to potentially stress out somebody who doesn't like it when things change very much. And then on top of that, we're moving from elementary school to middle school, which is stressful for a lot of kids, regardless of neurotype. Just life gets a lot more complicated. And there are so many more demands on your executive functioning. And it's a perfect storm. That's why we see so many of these kids, well, more girls than boys, but so many of these kids, it's around the start of middle school that things become clear. Wait a minute, there's something going on here. And I would encourage people not to rule out autism just because it wasn't evident during the preschool years necessarily. I find that when you look back and really look closely, you can find lots and lots of little evidence, just nothing that was ever big or glaring enough to catch somebody's attention.
And you do such a great job in the book going through and diving into this with many examples and all of these. And I encourage everybody to get both of the books, whether you, for everybody, with living with this, loving somebody with this, or serving somebody as a clinician and physician, because it's so needed. And not enough people know that we in the U.S. here, by the time this is live, getting closer to a political season, and every January, the United States has a State of the Union address. If you were going to give a State of the Autism address,
Oh my
what
goodness.
would you talk about where we are in the state? And I say that because a lot of people, when they get diagnosed, maybe meet somebody like myself or yourself, may be frustrated because why didn't everybody else? But where are we now? And then if you were going to, again, adding a little political fun with this, what would your platform be moving forward to help serve those who are getting the supports and the understanding that they need?
Wow. Okay. What a question. I'm glad you didn't ask me about politics. I thought you were headed there for a minute and thought,
No, it's it's just a good metaphor, playful, wherever you are with
it is a good metaphor.
You get to be the spokeswoman here for giving the
Wow.
press
Okay.
conference on the state. What is the state of where we're at?
Okay. The State of the Union part of that. What flashed through my mind when you said that was we're finally catching up. We have been missing so many autistic people for so long, and we are in a little phase now where the diagnosis rates are, I think, going through the roof. They're escalating, and people are going like, wait a minute, why is there so much more autism than there used to be? I don't know whether or not there's more autism than there used to be. I do know that we are getting way, way better at recognizing it. And the 45-year-old happily married attorney who would not have even remotely been considered for an autism diagnosis just 10 years ago now can access that diagnosis and be fully recognized as autistic. It's an example. It's particularly true of adults. And you mentioned this in your example. What's happening is a kid gets diagnosed, and then the adults in the family, whether it's a parent, a grandparent, an aunt, an uncle, a cousin, a sibling, everyone starts looking around going, oh, this makes sense. I can't tell you how often that happens when I diagnose a child or a teenager and I explain the diagnostic criteria and I'm moving through them. And one or both parents start to look at each other and they start to laugh and say, yeah, you're explaining my whole life. And so we're in this stage of catching up. And I think that's why some clinicians are starting to see so many people coming into their offices saying, hey, I think I might be autistic, or my child might be autistic. That's what went through my mind with the State of the Union part of it. As far as my platform, definitely I would like to see a major paradigm shift from external behaviors, not that we no longer want to look at those, we do, but to include the internal subjective experience, and another paradigm shift away from test scores, whether it's rating scales or social cognition tests, which are not super useful with this crowd, towards interviewing, understanding the story, really getting the history, really getting the person's experience. It's less about test scores and more about interviewing clinically. And I would really like to see that shift. People talk about a gold standard test for autism, which is a marketing term, and it does not apply to the kind of people we're talking about today, to autistics who camouflage, because it really is looking almost entirely for external observable behaviors for a very short period of time, like 45 minutes in a one-to-one sensory controlled environment. And that's not how you're going to get to the autism in autistics who camouflage. I would love to see that paradigm shift. And then I would also love to see many more clinicians having knowledge and confidence enough to bring up autism with their clients. There are way too many clinicians that don't feel confident about it. They didn't get training in it. They've even been given to believe, either implicitly or explicitly, they should not be looking for it or diagnosing it or even bringing it up with their clients. And I would really like to raise the understanding of autism on the part of clinicians and their courage to just go ahead and bring it up. So that's where I spend a lot of my time. And that's why we started writing this book. It was originally for clinicians, and we went with an academic publisher. We just thought, okay, maybe one day a handful of clinicians will read this book, and yay. And then we gradually, as we started to share it with people, we gradually realized, oh my God, a lot more people, not just clinicians, really need to and want to understand autism. And that's why we called it A Guide for Clinicians and Everyone Else in the end.